Hello everybody and good afternoon. I'm Amaliya from Dental Faculty, Padjadjaran University in Indonesia, and I will be sharing a pilot study of me and my colleagues, Dr. Agus and Jimmy Gunawan from Indonesia. And since I'm here, I prefer to deliver it on site for my poster presentation. So in dentistry, there is a gingival condition or gum swelling. It's called gingivitis, which is a defense mechanism of body in response to bacterial plaque attached to the tooth surface. And this inflammation is important since it safeguards the oral cavity or our mouth from bacterial attack. And however, several factors might affect the gum defense mechanism. For example, smoking. And smokers express less gingival inflammation and less gingival bleeding than non-smoking does. And smokers have a reduced capacity to maintain an effective defense mechanism to a given bacterial challenge. This may be due to a vasoconstrictive effect of nicotine. And smoking, considering as a masking effect, and make it difficult to define a good clinical diagnosis and prompt treatment when the signs are hidden, but the destructive process continues. And today, e-cigarettes or vape has become the most popular alternative tobacco products and has been said as less harmful to combustible tobacco product. And Wadia et al. Show in her pilot project that when smokers switch from smoking to vaping, there is a clear increase in gum bleeding as a sign of inflammation. And this pilot study aimed to observe the gingival response assessed by gingival inflammation and gum bleeding during an experimental gingivitis in Vapers. Okay. We are going to observe how the response of the gingival tissue in vapers compared to non-smoker and smokers when we give an experimental gingivitis with no toothbrushing for 21 days. This experimental gingivitis is a design of clinical trial for modeling the early phase of gingival inflammation by Lu and Silnes. So for material and methods, 15 volunteers participated in the present study, 5 non-smokers, 5 smokers, and 5 vapers, and the protocol was approved by Ethical Board of Medical Faculty, Universitas Padjadjaran, Bandung, Indonesia, and the informed consent was signed by each participant. For the inclusion criteria, the subject must be male or female 18 to 55 years old, and smoker has been smoking combustible cigarette for at least 1 year, and for vapor has been vaping with nicotine-contained e-liquid for at least 1 year. For non-smoker, never smokes nor vapes, and having a minimum of 10 teeth in lower jaw region, and no probing pocket depth more than 4 mm at any side, and bleeding on probing less than 10%. And for exclusion criteria is dual user, being pregnant or breastfeeding, having restoration orthodontic appliances or tooth decay around gum in lower jaw, having a history of drug abuse or using non-steroidal or steroidal anti-inflammatory drugs, analgesic, contraceptives, or antibiotics within 6 weeks before the study. And before the trial, acrylic stands were custom-made to cover an area in lower jaw teeth in order to avoid toothbrushing. So we are going to instruct the patient to abstain from any oral hygiene, including toothbrushing or mouth rinsing, or maybe interdental cleaning for about 21 days. And assessment performed were clinical parameters. It were clinical plaque index, gingival index, and angulated bleeding index, And we also confirm the nicotine by salivary cotinine level assessed by ELISA kit. And for the result, the pre-experimental period in which the participant received oral hygiene instruction, dental tooth scaling or cleaning, resulted in comparable low plaque accumulation and low gum inflammation at day 1. So all of the participants were healthy in the gingival. And during the 14 days and the 3rd week of oral hygiene abstention, no brushing, no tooth cleaning, the dental plaque increased significantly in all T groups, with no significant differences could be assessed in the rate of plaque accumulation. But with regard to gingival inflammation, the inflammation and gingival bleeding were increased significantly in both non-smokers and vapers group, whereas no increase in the smokers group during the 14 days and 21 days of experimental gingivitis without toothbrushing. And in conclusion, observable effects on the gingival tissue of replacing combustible tobacco product with e-cigarette containing nicotine are similar to the effects seen in smoking cessation. And increased gingival inflammation and bleeding in vapers during experimental gingivitis, presumably due to recovery of the peripheral vascular circulation. Despite the similar amount of bacterial plaque accumulation, smokers failed to display a normal inflammation and bleeding upon provocation, reflecting a suppressed gingival defense mechanism. And there was an obvious increase in gingival inflammation and gingival bleeding after 21 days of no brushing and vapers and non-smoker. In vapers who consume a liquid with nicotine, as confirmed by salivary cotinine levels. This is contradicting the claim of previous studies that gingival vasoconstriction by nicotine component is the cause of reduced bleeding and inflammation. So this is suggesting that it is caused instead by other features of the smoking and not nicotine. And under the limitation of our pilot study, we observe that vapers have similar gingival responses as non-smokers during 21 days of experimental gingivitis. Thank you for your attention.